respiratory infections workshop. My name is Ayuka Jones.
My name is Sydney Anderson.
My name is Kira Murrow.
My name is Valia Foster.
My name is Zoe Bartholomew.
My name is Jyotika Mahabaj.
My name is Rita Abiram.
My name is Tommy Kikirala.
My name is Daniel Rubin.
My name is Tabitha Ward.
My name is Lila Pan.
My name is Chloe Rojas.
And my name is Gianna Salsa.
AIR stands for acute respiratory infection. It's a disease that makes the network of your organs and tissue that helps you breathe become swell, which makes it difficult for you to breathe. And then, like the viral infections listed.
So let's talk about the social determinants of health. So ARIs are especially prevalent in northern Nigeria because of what we call social determinants of health. So there's a lot that we could talk about. There's a lot of things in Nigeria that there aren't as well as in the U.S. or other more developed countries. But the ones that we want to talk about today are healthcare insurance, sanitary problems, and the overall economy of the country. So let's start with the economy. So over 70% of the population in Nigeria is below the poverty line, which is $1.25 of income a day. And that is contributing to the amount of ARI spread in northern Nigeria. Basically, economy is the foundation of where most other problems spread. So because of the lack of income that most Nigerians have, healthcare is really hard to have, insurance, stuff like that, and just overall sanity is just not as well as places like the U.S. or places like the U.K. or Europe and stuff like that.
Okay, so let's take a moment and talk about the sanitary problems. In northern Nigeria, there is poor hygiene, making sanitary problems a common issue. 73% of ARIs are formed due to the poor sanitation, such as lack of clear water, among other factors.
So healthcare and insurance are very hard for people to acquire in Nigeria. And it is also very expensive to acquire these two. So people who do acquire health insurance are mostly located in southern Nigeria, and people in northern Nigeria usually pay out of pocket for these expenses. Less than 10% of the population actually has health insurance, and although people do pay out of pocket, the quality of care that they receive is poor, and when you look into more rural areas, the conditions become worse.
The overall objectives of our workshop revolves around three main concepts: identification, preparation, and comprehension. So at the end of our workshop, participants should be able to identify at least 3 to 5 symptoms of ARIs. Because if they are able to identify the problem, they will be able to also prepare, so be able to take the preventative measures and also the treatment measures, as well as understand and comprehend the importance of seeking professional help to help eliminate the problem.
So let's talk about the group's size and session length. So ideally we want 30 people in our session. We could have had more, but we decided that we wanted a smaller smaller participant size because we want to encourage discussion. And it's designed to have 1 hour, 30 minutes for prevention and 30 minutes for treatment. It might run a little over than an hour though, because with the discussion and we have all the food and refreshments provided. And also our target group for our workshop is going to be older people, people are immunocompromised, and people with genetic respiratory illness, because these people are the ones that are more susceptible to ARIs. So we wanted to spread more awareness to those people, because those are the people that are more likely to get them than the rest of the population.
Okay, so as already stated, our workshops is split into 2 groups, the prevention and treatment group. So how our presentation is kind of set up is first we go through the general information and background, then we talk about the social determinants of health and why it's important to do a workshop and how it's helping. And then we're going to move on to the plans for the prevention workshop, and then we're going to move on to the plans for the treatment workshop, and we'll end with a conclusion.
Alright, so we're going to have the prevention team talk about their activities for the workshop.
Learning goals. The goal of the workshop is to cheer on your teammates by communicating with everyone and making them feel included. More teammates mean more new information being learned, which is a good thing. Not to mention, it's also a great thing for building new relationships with people you never met before.
So the objective of the prevention workshop is to educate participants about the preventative part of ARIs. And this goal is to illustrate the importance of preventative measures in order to reduce the chance of catching the ARI in the first place. We will be doing this through educating participants about how acute respiratory infections can be spread, transmitted, as well as talking about the risky areas where chance of infection is higher, and giving tips for protection in order for them to protect themselves and their peers from ARIs.
Alright, so if you want to know how to prevent it from getting ARIs, you need to know how to spread. There are three main ways, such as contact, spray of large particles, and airborne. 10% of ARIs are spread through brief contact, such as a simple handshake, while the other 40 to 90% of ARIs are spread through long and direct contact. ARI transmission also occurs through air droplets that go from an infected person to the surrounding, and the infection is located in the nuclei of those air droplets.
So the pre and post test, we will be asking facilitators in Bounchy to administer the same test before the workshop has begun and after it has concluded. We will also be asking them to read the questions to the participants to make sure that everyone understands exactly what we are asking. Participants simply will have to circle yes or no so that we can compare the information that they already knew versus the information that they have obtained.
Okay, so for activity number 1, we have a mini lesson. Basically, the facilitators will be putting on a slideshow which is prepared by our team. And the only materials needed for this activity is a projector and a computer connected to the internet. During this presentation, they will dive into the topics including what is acute respiratory infection, what are the risk factors, what are the areas of risk, how does it spread, and most importantly, how do they prevent and protect themselves from contacting and spreading ARI. And so the purpose of this activity is to, of course, teach them, and this will also prep them for the following activities as the content in those revolve around the information of these sessions. So moving on to activity number 2, this is our scenario identification activity. So for this one, they will get further understanding of the types of prevention and when and where to use them. Materials again are very simple. We have 2 different handouts and pencils. So the first handout will be for the facilitators' use. It's basically just a sheet of paper with 6 different scenarios that will be read to the participants. And then the second handout is going to be really just a simple piece of paper that every participant is going to get. And there's literally just 2 words, agree and disagree. So once they print out all the handouts that will be needed and hand out the pencils that everyone will use, the facilitators will one by one read out each scenario. And after they read out the scenario, each participant will take their agree or disagree piece of paper and pencil, and they will circle whether they agree with what's happening in the scenario or if they disagree with what's happening in the scenario. And after they do that, they will discuss with people around them. And once everyone gets to share their opinions and ideas, the facilitator will reveal the answer and why they should either be agreeing with the scenario or if they should be disagreeing with the scenario. And so because, as I explained, there are 6 scenarios, they will repeat that until all are completed. And this will really just test the ability of their decision making, of the types of prevention methods, and when and where they will use it.
So last but not least, the third activity is going to be a quick and simple game with the purpose of demonstrating the importance of preventative measures with a focus on washing our hands, because ARIs can spread very quickly and very easily if the right measures are not taken. The only material required for this activity is baby powder, and how it's going to work is that out of the 30 participants we have, 8 of them will be infected. So this means that they will apply baby powder to their hands to represent the germs of the infection. Four of the infected people will wash their hands with soap and water for at least 20 seconds, demonstrating how they can wash off the infection if they wash their hands, while the other four will not, demonstrating how if they don't wash their hands, the bacteria or the viruses will stay with them. After this, those 8 will interact with the rest of the 22 participants, such as giving them handshakes or high-fiving them. And so you can probably imagine, by the end of the scenario, everyone will have baby powder on their hands. This demonstrates how, because those 4 people didn't wash their hands of the bacteria or the virus, they managed to spread it to everyone else in the group. This provides them the ability to visualize the quick spread of bacteria and viruses and how preventative measures such as washing your hands can help. After, they will have the chance to discuss what they've learned and what they did, which is, again, the importance of preventative measures such as washing hands. And here we have 3 of our flyers that we're handing out. So on that one, we can see it's prevention methods. And these 2 are both informational flyers, but for different groups of people, depending on their literacy levels. So that one has more pictures in case they can't read as much, and this one has more information if they would like.
Now that the prevention team has summarized their portion of the workshop, we are now going to move on to the treatment.
So the overall objective of our treatment lesson is to be very simple. We're just going to have 3 workshops. One workshop will be a discussion workshop, and then 2 of the other workshops will be interactive and informative.
Although bacteria and viral ARIs are treated differently, antipyretics and cough syrup can be used to treat symptoms of both. Bacterial ARIs must be treated using antibiotics such as amoxicillin, and viral ARIs do not have a medical treatment and must be treated through hydration and nutrition. It is important to recognize how to treat both types of ARIs to reduce symptoms and prevent complications that can result from not knowing how to properly treat them, and to know how to treat them in the future.
So the first activity done by the treatment team is a discussion where the facilitator will essentially give around a 5-minute speech detailing the differences between bacterial and viral acute respiratory infections. So the facilitator will go into detail on things like the difference between symptoms, treatment, and all the other stuff in order to make sure that all the members understand that both of them are actually very different, even though symptoms may present similarly. So this is once again really, really important because because all members need to understand the severity of their disease and understand how to best treat it, how to best move forward. Otherwise, they might not do anything about it. So the information in this discussion will also be used in the next activity where they play a game kind of testing their knowledge on this. So as I mentioned, the next activity is a game, and essentially how the game works is that, like we said before, we're going to have around 30 people, and the 30 people are going to be split into groups of 2, so we'll have 15 and 15. And both groups will work, each group will work collectively to come up with an answer to 6 questions, such as, is a dry cough a symptom of a viral or bacterial infection? So in this situation, in order to get the answer correct, we have both of a virus. And the team that would win is the team that would get the most answers correct.
For our third activity, we're going to be making lemongrass tea with the participants. This is supposed to be used as a home remedy for symptoms of an ARI. The facilitator will start the discussion with some background information and a disclaimer.
The disclaimer being that the lemongrass tea, which is a homemade remedy, and any homemade remedy should not be used in substitution of a medical treatment, and it should only be used as a last resort.
If a participant has the access to a medical clinic, that should always be their first response to an ARI. However, while waiting for treatment or in a situation where treatment is not accessible, this is another alternative that we are doing.
The treatment portion of the workshop also includes pre and post tests. The post test is an opportunity for participants to demonstrate that they've gained the knowledge conveyed through the activities. For example, one of the questions is, Do you know how to differentiate between viral and bacterial ARIs? So these questions are specifically designed for participants to demonstrate their knowledge and reflect on the content they've just learned. In short, this should help ensure that the participants have a sense of confidence in their knowledge.
Here is a picture of our brochure that will be handed out during the workshop to provide more information about ARIs. Our brochure includes information on the background of an ARI, the common symptoms, the difference between a bacterial and viral infection, as well as simple home remedies. Also, on the back of our brochure, we have provided contact information about the initiative program and also contact information about the nearest hospitals and clinics and options.
So this is the funding that we have provided, and this is basically similar to what my team and I have decided to use our money for. We have decided that transportational costs will be provided for each participant to get to and from the location site. The total cost that we have used has come down to about $449, and the money left over has come down to about $1,050. Now Nadia will come up to explain how we have decided to donate the rest of the money and how it will benefit the citizens of Nigeria.
So we decided that we would donate the rest of the money to the Nagari Medical Hospital Maternity Clinic. And through this, we would provide a card, as shown up on the screen, to give to the participants. And what the participants would do is anytime they needed any sort of medication or an appointment, they would give this card to the Nagari Medical Hospital, and Leadership Initiatives, with the money that we donated, would provide a 50% copay as a way to incentivize them to seek help, as a way to alleviate any sort of money concerns that they might have.
As a team, we have created a fundraiser to advertise, to encourage the people of Bauchi to come and visit our workshop. The date, time, and locations to be determined.
So after watching his presentation, some people may wonder what they can do to help. And the best thing to do is to teach others about what you've learned about ARIs, as well as donate money to organizations that can help the situation by improving the sanitation and the medical facilities.
Dr. Aisha, your feedback.
Why always me? I don't mind. Thank you very much, guys, for this presentation. I can clearly see hard work and input, and you guys have definitely and certainly done some work. But I have a little bit of problem with not the whole presentation per se, because it has a lot of good part, but the organization of the slides. So I was a bit confused because, okay, I didn't know, do we have the health literacy team? Is there
not this week, because there's only 2 teams.
Sorry?
Not this week, because there's only 2 teams.
Okay, no, because I was confused. I was waiting for, okay, now I understand. So what teams are these? Okay. Forgive me. Forgive me, because I was waiting for good introduction of ARI, and most of my comments here are about, okay, so where's ARI? What's happening? Yeah.
We didn't include it in the presentation, and that's probably our fault, but as Tiffany mentioned, our first activity in the prevention team is a short mini lesson, and on that mini lesson we have like the background of what an ARI is and some of that kind of stuff.
Okay.
Just didn't put it.
Okay, no problem. So I was a little bit confused because I was like, why did prevention come before anything else? So, but that's okay. So I was just here, I have boldly written health literacy, where is it? Okay, that's fine. The activities were excellent. Okay, I loved them. The confidence, the ideas, the whole activity, the dynamics, everything was really okay. And I would have
expected some few words about COVID as well, with regards to prevention of ARIs, Now, information is out there regarding ARIs and so the question could be that what are you doing differently from what is already out there, which you have highlighted in your activities and which would help these people. So the activities were excellent, The flyers, amazing. I like everything about the flyers. Self-explanatory, since you're not going to be there to explain, so your flyers are there to scream it out for you guys. So really well done. And for the treatment group, you mentioned that viral ARIs do not have treatment, which is correct. And then you mentioned just 2 treatments, saying these are the 2 treatments. I have a feeling that it could have been more, meaning that you mentioned just hydration and antipyretic. So most of the time, we keep saying viral ARIs are for the treatment is symptomatic. So the person with a cough, an antipyretic will not help. Hydration would not help. Okay? So I think the best thing is to say that viral ARIs is symptomatic treatment. If the person has cough, you give cough syrup. If the person has fever, you give anti-fever. If the person is sneezing, runny nose, allergy type looking symptom, you give antihistamines like Benadryl. Okay, so that would have been more, but it's okay since you said it doesn't have a treatment. But you don't want a situation whereby a patient will just sit down because they have severe cough and they say, there's really nothing I can do, and yeah, so it's symptomatic treatment. The brochure is a very good attempt. I think this is the first time I'm seeing such idea, and I like it. It's really wonderful. And I liked how you elaborated on your logistics. Okay, this is a non-profit organization, and you all are, your aim is to help out people. So it's good to always be transparent, and you even converted the money to Naira to see how you're going to spend the money. So that was really great and wonderful. Okay, well done, guys. You did a wonderful job. Okay, the presentation was amazing, and it showed that you had put in a lot of work and research into your work. Thank you very much. It was great. I'm proud of you guys.
Okay. I'm going to mention it again. The most important thing to me is teamwork, and I've seen it in your team, which is amazing. And one thing I can be honest with you is that you're not making that presentation to doctors. You're making this presentation to ordinary people who have no knowledge about ARI. And to be honest, I get every single part of it. And everyone will get this message because it is straightforward, simple, well elaborated. I'm really, really excited about this. And this is one of my good presentations that I would like to really see working, especially for the people with ARI. So you guys have done a great job. You should be proud of yourself. This is an amazing job. I love the simulation of your presentation. You use a very good graphics that can really speak loud. It's amazing. Use of local remedies. Oh, you tempted me to start taking my paint. So, yeah, it's really, really amazing. And you talked about, you make an emphasis that this is actually like an alternative. So people should not think that this is a treatment.
True.
So, but in absence of all, this is an alternative. So people can actually say, oh, so I shouldn't take that as a treatment. So I still have to see a doctor or something like that. This is really a smart move because this is what people need to see. Whenever you're making a presentation, people take you as somebody who knows something. And whatever you tell them, they believe you. So if you tell them that this is a treatment, no question about it, they're going to sit down at home and keep taking those things till when they get fined. So, but you guys make it very, very clear for them, and which is a great thing to do, to educate people. And like Dr. Aisha says, that you manage your resources. I love it. This is the most tricky thing you did by coming up with the card. It's not all about putting the money there, but all about how the money is going to be spent and on who. Being specific about this thing is incredible. Because this is accountability. And this is more or less like giving an insurance, like handing over those cards is an insurance given to these people who participated during the program. And this is to tell you that your money is going to be used wisely. So, guys, you nailed it. And I'm really, really proud that you were able to put all these things together. And you also make an invitation card, which makes it much more easier. So, congratulations, guys, and go home proud. And your parents will be proud of you, just as Umar is proud of you today.
I loved the explicit discussion of the social determinants of health, and especially breaking that down. I think that really, really sets up the rest of the presentation well to understand the context of why we're talking about it. Because a lot of people, especially with ARI, say, oh, so it's a common cold. And there's actually a lot more to it, and a lot more moving parts that impact why they're spread and why they can be so deadly. For prevention, the baby powder activity is awesome. I love it's like fun, simple, affordable, and all of the graphics throughout that portion were really, really spot on. For treatment, the pre and post test is really, really clear. I think that's going to especially go over well, just the way that it's set up. And the discussion of bacterial versus viral is probably the most important thing that you can do, because it can be so decisive. If people understand, okay, I have these symptoms, X, Y, and Z, and it's a viral infection, there really isn't much I can do, that could potentially save them a lot of time and a lot of money and a lot of investigation, if there really is truly nothing they can do besides supportive care that they can access on their own, versus if they are feeling like it's pneumonia or something bacterial that there's a treatment for, then it's really, really worthwhile to seek that direct care and treatment. Just the other day, Umar and I were discussing what we're going to have to do with all the donations going to Nagari throughout the last few weeks, because a lot of teams had a lot of funds to set aside. And we were talking about having a card for people to go bring it to Nagari and get part or all of their treatment paid for. It's a complicated system to set up. And so there's a lot of considerations that we need to have in order both to use funds effectively and make sure the right people are using them. But that is exactly what a lot of the donation money was going to go to anyway. So it's really, really cool that your team devised that plan as a direct use of your donation. So we're really excited to implement that this fall. And overall, really, really great, concise, organized, clean, and effective presentation. So great work.